Hi everyone, I'm Leanne Barrett. I'm a genetic counsellor currently working at Great Ormond Street Hospital, and I'm based in London. And I'm here today to present to you my research looking at the psychosocial impact of living with vascular Ehlers-Danlos syndrome. And this was something that I looked at whilst I was a student at Cardiff University in Wales. So vascular Ehlers-Danlos syndrome, just a little wraparound about what it is. I'm sure most of you are already aware, but vascular EDS is an autosomal dominant condition that is caused by mutations in a gene called COL3A1. And the condition itself is characterized by excessive bruising, tissue fragility, thin translucent skin, and an increased risk of sudden death due to vascular rupture. And it's that increased risk of sudden death that sort of led me to get onto my research journey in looking at the psychosocial impact of the condition, because as Byers very greatly mentioned in 2017, this is something that is quite often neglected. And all the published literature on the psychosocial impact of the condition looks at other forms of EDS or aortopathies or other sudden death disorders, which aren't exactly the same as vascular Ehlers-Danlos syndrome. So my literature review, I looked at a range of different conditions that were kind of similar to vascular EDS, because as I mentioned, there's no research on that specifically. But any vascular EDS studies that I did find were combined with Marfan syndrome and Loeys-Dietz, and none of those studies were done in the UK. I looked at sudden death disorders, including long QT syndrome and hypertrophic cardiomyopathy. I looked at EDS studies, so the classical and hypermobile forms of EDS. And I also looked at Loeys-Dietz syndrome and Marfan syndrome. So my study basically aimed to explore the day-to-day experiences of living with the condition, the impact the condition can have on work and study, the implications of living with a condition that limits your life, patients' mental health, their social life, their relationships, and their concerns about having children with the condition, but also how it made them think about having a family of their own if they were affected and didn't have children. So just a little summary of my sort of research journey. I recruited through an amazing charity here in the UK called Annabelle's Challenge. So I worked directly with their coordinator, which was very helpful. And we sort of sent out a email with an advert of the study to the members, and initially got back quite a few responses. So after participants had got in contact with me, we had an initial call to discuss the study. I then conducted semi-structured telephone interviews that lasted between 45 minutes and an hour long. And then I also offered all participants a debrief phone call around a month after they had done their initial interview with me. And that was just to give them a chance to reflect on their experience, because the conversation in many cases was quite emotive and, brought up a lot of unearthed feelings. So it was a nice opportunity for them to have a look back on that experience. And then I analysed my data using thematic analysis, and that led me to identify my themes. So my results, I initially had 34 consent forms back, and of those 34, 21 participants were interviewed, which was a great number. I had 18 women and 3 men, and the age range was between 19 to 61 years old. So 6 key themes were identified using thematic analysis, and these were the physical limitations to daily life, risk perception and existential thoughts, communication and support, responsibility, loss, resilience, and coping mechanisms. And I'm just going to go through all of these in a little bit more detail because just they're quite summarised here. So physical limitations to daily life. Something that really shined through in this theme was the impact of fatigue and pain on daily life, and how this actually, in most cases, was a huge indicator to how patients felt mentally and emotionally. And that kind of led into time and energy management. So this idea of always having to plan out their day and daily activities, and knowing that they had a limit, and once they reached that limit, if they were going to do more and push themselves, they'd be borrowing time from the next day, essentially. Engaging in social activities, this was seen as more stressful than fun. A lot of the participants commented on having to risk assess each situation. So if they're going out for dinner, some of them commented that they were quite worried someone might bang their leg and that would lead to a bruise. So things like that was sort of things they'd have to think about that we wouldn't necessarily think about. Inability to carry out activities and tasks. So things that they originally said they found easy and quite simple to do, they were now finding really difficult, and they were seeing them as obstacles in their day. Intimacy was something that I didn't ask participants about, but actually came up quite a bit in a few conversations. And it was this idea of the fear of provoking a vascular episode during intimacy, which I thought was really interesting because it's not necessarily something that I'd originally thought about. And then achievements and accomplishments. So a lot of participants were comparing themselves to their peers and their colleagues on how they would be or what their lives would be like if they didn't have the condition. So moving on to risk perception, existential thoughts, the idea of living cautiously. So, you know, a lot of them had experienced a serious vascular EDS event, which we described as an episode that resulted in surgery or prolonged hospital admission. And that was something that they really stuck with them. So, for example, one participant had her episode when she was going up the stairs at work. And now every time she goes up the stairs, she's worried that a similar thing might happen. Obtaining diagnosis, fear, relief, or regret. This was something that I thought was really interesting. A lot of it was quite spread across participants. So some of them were very happy to receive their diagnosis after years and years of questioning certain symptoms and not having an answer. Some were fearful. Obviously, it's a massive shock. And if they already had children, it was very difficult to then manage their diagnosis and a potential diagnosis for their child. And also regret. So some participants, especially those that were diagnosed later in life, kind of reflected on how they felt before they knew and felt they lived their lives a lot easier without knowing than they do now because they're actively being cautious. And that kind of led into the future and growing old. So those conversations about will they see their grandchildren, you know, what does that look like for them? And then what if? So comparing their life without a vascular EDS diagnosis. This idea of feeling different amongst others, so the comparison, the not being able to do similar things to their friends, especially in the younger groups. This was a massive thing that came out. There were quite a few young participants, as I said. You know, my youngest participant was 19 years old, and this was definitely something that they compared themselves with. And then understanding vascular EDS as an invisible condition. So the idea that for some of them, they actually didn't physically present with the condition, obviously. So people really questioned, you know, if they were saying they were really tired or they were in pain, but that wasn't visible. That sort of managing those thoughts they found quite difficult. Communication and support was huge, and I think was a really important part of a lot of participants' journey. So the idea of discussing the diagnosis within their family, there was very conflicting views. Some people were very happy to do that. Some people didn't talk about it at all with their families. And it was the same with friends. So if people explained, you know, how those conversations came about with friends, it's very difficult for them to understand because they weren't going through what they were going through. And this idea of a lack of faith in healthcare professionals was very prominent. So almost every participant said they don't really feel that their care is being managed effectively because the condition is so rare. So when they do see healthcare professionals, they're not necessarily being heard. And that is kind of the reason why a lot of them have had such a late diagnosis in life and been through quite a lot of trauma because they didn't feel like they received the correct and relevant amount of care from healthcare professionals. Then we touched on the support groups for vascular EDS patients and the idea of striking a balance, because as much as them being really useful and really helpful for participants, some of them actually felt that it was a space for people to kind of moan and bring negative vibes as well. So they were kind of talking about the positives and having to sort of create a barrier for themselves about how much they would give and how much time they would give in those settings. When to tell and how to tell. Similarly to the family unit and friends, you know, when is the right time to have that conversation with your friends? Do you tell someone that you've just met on a date, or do you not tell them? You know, those kind of conversations. And it's the same in relationships. So participants reported a lot of barriers in their relationships, especially with their partners, because it was almost this feeling of guilt that, you know, one day they might not be here and what they're leaving behind. And then differences within the vascular EDS community that kind of ties into the support group, that some people are very positive and others are, you know, going through a lot. And that is kind of brought out in their how they share amongst support groups and things. The next theme is a world of responsibility. So this really was about concern for future generations. Parental guilt was massive. Any participant that had a child felt guilty. That was a word that they constantly use. And this idea of protection, you know, one mother did comment that both of her sons were affected, and she almost felt like, she said that she would want them to go before her because she wants to make sure that if she's not there, she doesn't know if their care is going to be taken into consideration, you know, if they're going to be cared for as well as she would have liked. So, you know, that was a really hard-hitting comment, but it just kind of encapsulates how difficult it is for parents who are affected themselves and then caring for an affected child. Personal health and management. So this idea of ownership of the condition kind of ties into the lack of faith in healthcare professionals. So participants were very clear on the fact that because healthcare professionals didn't know much, they felt they had to do more in order to manage the condition properly. Career progression was also something that they spoke about, not being able to focus on the career that they originally wanted to do because of the condition, and financial uncertainty, which was really important because it was something I hadn't considered. But conversations about saving for a pension, do you save for a pension, or do you spend the money now because you don't actually know if you're going to be here to claim that pension at 65 years old? So those kind of conversations. And lastly, they felt responsible to raise awareness within their community, and this idea of companionship, so supporting, especially for older participants, they felt they had a responsibility to almost guide and bring positivity to the younger members the younger members that suffer from vascular EDS. So that was quite a nice thing as well. And the last two themes, so loss, this played out, I think, with every single participant in a different way. All of them commented on a loss of identity. A lot of them struggled to differentiate themselves from their diagnosis. Social freedom and independence, the idea of just being able to go out and get some milk from the shop, these are things that were now becoming very difficult, and that kind of fed into them not wanting to socialise anymore because it became more of a faff than fun. Choices around pregnancy and having a family, this idea of anticipated loss. So for women that had not had a diagnosis, that had a diagnosis but hadn't had children, it was this idea of anticipated loss that they actually probably wouldn't have children, or they'd have to undergo certain testing in order to have children, but the actual process of being pregnant would be quite dangerous for their health as well. So it was having those conversations. And the lasting impact of losing a family member to vascular EDS. So a lot of the participants were not the first in their family to be diagnosed, and sadly some of them had lost family members, and that kind of really impacted those that were still here, because they felt that they were, for example, if their parent had died at 50, they were reaching their 49th birthday and having, a lot of anxiety about whether they're going to see 50 years old. And lastly, resilience and coping mechanisms. This is something that I thought was really important to highlight in my dissertation research, because the group of people that I spoke to were amazing. And they were so positive, despite their circumstances. All of them had a way of having a positive outlook on life. They were very thankful, and they were happy to share, their coping mechanisms in the hope that this research would help others and others would read it. So exercise was something that all of them said, even though it might have been very low impact. So something like yoga, like low intensity yoga, for example, participants reported that had a massive impact on their mental health. And the idea of thought management and diagnosis. So compartmentalizing the diagnosis and not making that a massive part of them, but living their lives around it, was quite an important factor for a lot of participants. And appreciation for life. All of them were thankful that they've lived to see the day that they were at, and they were very aware of the fact that sometimes, people with vascular EDS die in their childhood. So the fact that they were adults and being able to have that conversation, the conversation with me, they were very thankful. And lastly, this idea of providing a voice to the unheard. They felt that this research study gave them the opportunity to speak and for their voices to be heard in a condition that is very rare and not many people have heard of. They really appreciated the opportunity to just talk to someone and raise some kind of awareness about the condition and how it impacts their lives. So lastly, just some additional findings that I thought were quite interesting to report. Over half of the participants had mental health issues due to the condition. Many of them accessed mental health support, and this was usually in the form of CBT or medication. Support and awareness from healthcare professionals was the key thing that every participant named as something that would improve their patient experience. So as you can see from the graph on the right-hand side, a lot of them listed some other things like general awareness of the condition, but increased awareness from healthcare professionals was the most important thing. And one thing that I did comment on was that care for vascular EDS patients could be improved by upskilling healthcare professionals to address those psychosocial aspects using psychotherapeutic approaches, so that these patients are not just getting physical support, but also support for their mental and emotional well-being. And just lastly, I thought it was worth mentioning some future psychosocial research opportunities with vascular EDS patients. So larger sample size, for example. Obviously, I was very lucky to have 21 participants, but there's definitely scope for more people. The impact of age at diagnosis, I think this was really key because there was a massive difference between those that were diagnosed later in life and their attitudes towards life. and those that were diagnosed at a young age. And actually the participants that were diagnosed at a young age were more anxious, they were less likely to want to go out and socialise, in comparison to those that were diagnosed later who already had lived experiences. So I think that was a really interesting area to look into. Male studies, you know, the majority of my participants were women, so there's definitely an opportunity there to speak to male participants and get, you know, more of an idea of their experiences. Intimacy and relationships, as I mentioned before, I thought that was really interesting that it came up, so there's definitely an avenue to explore there. Studies that look at quality of life are always useful for, and especially vascular EDS, because there isn't any. And lastly, anything that looks at coping mechanisms, because I do think that was really helpful for participants to have that conversation, and actually, you know, that these are things that can then be shared amongst the community. So yeah, I've just commented that participants found the interview process empowering, and they commented that they had taken part to help raise awareness and contribute to the future care of patients with vascular EDS. And there's just some quotes here from participants who also mentioned that they are very open to future research opportunities. So this one here, I signed this research because I thought it would be a bit hypocritical to complain about the condition and not at least attempt to advance science and the knowledge of it. And I just think it's really nice that they got something out of it as well. So there's definitely scope for more research in the future. So yeah, I just want to say thank you very much for listening. I'm in the process of publishing my dissertation research, but if you did want to read the full dissertation in the meantime, then you're more than welcome to email me and I'll happily send that over. Thank you very much.